Okay, so good afternoon, everyone. Welcome to the Governor's Interagency Advisory Council on Homelessness to Housing. This meeting has been publicly noticed in compliance with Nevada's open meeting law, and co-chair Robert Thompson will call the meeting to order.
Good afternoon. It is 1:01 p.m. and I'd like to call the July 18th, 2024 meeting of the Nevada Interagency Council on Homelessness to Housing in order. Shelley, will you please call roll?
Yes, all right. Chair Tim Robb, although we know he'll be absent. Senator Dina Neal. Assemblyman Max Carter. Deputy Director Emily Testweed.
Here.
Administrator Robert Thompson.
Here.
Administrator Stephen Acroft.
Here.
Colonel Mary Devine.
Here.
Lieutenant Christopher Gorell. Sheriff Jerry Allen. Judge Mike Montero. Dr. Katrina Grigsby Thedford.
Here.
Judge Christy Craig. And Lieutenant Shatawna Daniel. Shatawna, I see your hands raised. Are you able to speak?
Sorry, I apologize. My mic was not working.
No worries. Thank you. All right, we just need to give it another minute, Robert. We're not quite at quorum.
Kelly, this is Ryan at the Attorney General's office. How many members are on the
We
committee?
have six right
You
now.
have 6 there. How many are on the committee though?
Oh, I believe 13.
Okay, so you need one more?
Yes.
Yeah, okay. All right, just checking.
Shelley, we have 3 presentations today, so let's give it a few minutes in case maybe somebody got caught in traffic or is running a minute late.
Okay, sounds good.
This is Mary Devine. I will have to drop off a little bit early for another meeting that I can't reschedule. So I will have to drop off about 1:30.
Okay. Ryan, is it possible for us to continue with just the items that don't require action so that the council members who are here can hear the presentations? Or would
Yeah,
we
let me look
cancel
at the-
entirely?
Let me look at the agenda real quick. So it looks like the only action is right at the beginning, which is the approval of the last minutes, and the rest of it is information only. So that it's, so long as you knock that out of the way while you have a quorum and then a member leaves, that's fine. You can do the informationals only, as long as you don't engage in deliberation while the information is being presented, so long as it's just presentation.
Okay. And if we don't reach quorum, we can just
Yes, just
put
cancel.
those to the next meeting. Okay.
Yep.
So council, did I hear you correctly that we could start the meeting with the informational items and set the one action item aside in case, and if we do meet quorum, then vote on the minutes?
Bear with me for just a sec. Sorry about that. I had somebody come in the office. What was your question again, Robert? Sorry.
Could we skip item number 3, go ahead and move with informational, and if other members join, go back to item number 3 to vote on the minutes? The only item we have to vote on is minutes.
Yeah, I suppose you could do. I prefer not, but you could do that. I think pursuant to the rules, it would be okay.
Shelley, did we meet quorum?
So far, no.
This is Senator Neal. I just got on.
So
Hi,
we've
Senator
met-
Neal. I just need to
Hi.
take our roll again, and then we should be at quorum.
Okay, great.
All right, sounds good.
All right, so let's try that again. Taking roll, do we have Chair Tim Robb? Senator Dina Neal?
Here.
Assemblyman Max Carter? Deputy Director Emily Testweed?
Present here.
Administrator Robert Thompson?
Here.
Administrator Stephen Acroft?
Here.
Colonel Mary Devine?
Here.
Lieutenant Christopher Gurrell? Sheriff Jerry Allen? Judge Mike Montero? Dr. Katrina Grigsby Thedford?
Here.
Judge Christy Craig? And Lieutenant Shatawna Daniel.
Here.
All right, Robert, we are at 7. We have quorum.
Thank you. We'll now move to agenda item 2. Item 2 on the agenda is public comment. No action may be taken upon a matter until the matter has been specifically added to the agenda. Comments are limited to 3 minutes. If you are making public comment via phone, please call 1-775-321-6111, ID number 459-071-500#. We are now open for public comment. Please unmute yourself and state your name for the council. Do we have anyone on for public comment? Okay, closing public comment. We will now move on to item agenda 3, discussion and possible approval of meeting minutes for May 23, 2024 on the Interagency Advisory Council on Homeless to Housing. Do we have any discussion on the minutes? Do we have a motion to approve the minutes?
This is Administrator Acroft, move to approve.
Thank you. Do we have a second?
It's the
Second.
Georgia
That's
Mary. Oh, go ahead.
Dr. Katrina, I second the approval.
All those in favor? Aye.
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 Any opposed? Okay, indulge me for one moment, Shelley, before we move to item number 4, which is an informational item. I would like to take a moment to recognize Lieutenant Shatawna Daniel, who was recently appointed to the council to replace Captain Brandon Zirkle. Welcome, Shatawna. Council, can we take a moment to let Shatawna introduce herself? If it's not agendized? Because I'm just going to do it if you don't say no.
Is it okay to, do you
Council
want me to
hasn't said
introduce
we.
myself?
Go ahead, Shatawna. Council hasn't said I can't.
So I'm Shatawna Daniel. I'm a lieutenant with the Washoe County Sheriff's Office. In 2021, I built our homeless outreach proactive engagement team for the Washoe County Sheriff's Office. So I am extremely excited to be a part of this. It is near and dear to my heart. I'm extremely passionate about working with our homeless population and all of you. I've learned so much in just a short amount of time. I've been with the county for 25 years in April. I will have been in law enforcement, so it's been a long time. So this is definitely a different approach to the things I've done in the past. So I'm just looking forward to working with all of you and seeing what we can do.
Thank you and welcome. Welcome. We will now move to agenda item number 4, which is informational only. We have a presentation by Austin Borrell of the Civic Roundtable regarding the Civic Roundtable Platform, which is designed to foster collaboration and project management across communities. Austin, we are all yours. Will you be sharing your screen?
Yes, we will, if that's all right.
Of course.
Awesome. Thank you, Chair. Thank you, Shelley. And thanks, everybody, for having us. Really excited to bring you into the product we've built with other state agencies, ICHs, COCs across the country, to introduce you to ourselves and our work. And whether it is today or in the future, to get your guidance and feedback on how our product can be of service to many of the COCs and committees we've been talking to and learning from across the state. My name's Austin, one of the co-founders of Civic Roundtable, and I'm joined by my co-founder, Madeline, who hopefully will pop up in a minute. I'm going to first tell you a bit about what brought us to the work, and then we'll quickly get into an overview of our progress to date, and then jump into a product demo, just to give you a taste of what we've built and how it can be helpful to many of the COCs and other committees that, again, we've been learning from across the state. I started this work at the federal level. I'm mainly focused on people management, org design, and operations, from HQ in DC to field offices across the country. Then tackled a lot of this coordination challenge that agencies faced federally at the state and local level. Heard time and again how challenging it was and is to get different offices and agencies to talk to each other. And that, I know, is a huge part of what this ICH is designed to do. What we found, though, is that it can be really hard outside of rooms like this, and especially at the front line of a lot of the agencies and organizations that are represented here, to actually get to know who's working on shared challenges beyond your team, your office, or your agency. A lot of folks I know in the status quo might be using different platforms like the one we're on today, might be going to public websites, might be calling up someone like Shelley to understand who to talk to at another agency. And what we've built to address that challenge is a collaboration platform and knowledge management ecosystem, designed with and for practitioners in and around the homelessness and human services arena. And our hope here is to ensure that the progress we've made with state agencies and ICHs across the country is not just helpful to them, but also helpful to you all. We started that in conversation, not just with the Technical Assistance Committee. I know some folks like Brooke are on this call and have heard from us before. We've also been in conversation with the rural COC and others to understand how what we've built can be of service to them. So the opportunity here today is really just to bring you in to those conversations and to the product we've built. And again, whether it's today or in the future, to get your guidance and your feedback on how what we've built can be of service to a lot of the practitioners that are in the fields that you all serve. Before I get into the overview, wanted to first give Madeline a chance to introduce herself, and then can walk you through what we've done and what we've built so far.
Great to be with everybody. My name is Madeline. I'm one of the other co-founders of Civic Roundtable. Excited to bring you into our product in a minute and hopefully have follow-on conversations in the future to just get your feedback and input. My background is in building technology for the public sector. I started working with first responder, specifically all over the country, on records management, dispatch, and case management tools, and just saw time and time again how important it is for practitioners doing mission critical work to be supported by technology that actually helps and gives time back and makes things easier, and have just been inspired where technology meets mission to help kind of put up our hands and see what we can do to build something that's useful. So I'll turn it back to Austin.
Awesome. Thanks, Madeline. I'm going to bring you into a couple of pages that you might have received in the, I guess, pre-meeting package. Can I get a thumbs up for folks who can see my screen? All right, I'm seeing 3. Thank you. The problem that we're solving here is information overload. This is something that we heard a whole lot about from the Technical Assistance Committee, as well as the Executive Committee of the Rural Nevada COC. I think what resonates most deeply is the idea of folks facing similar challenges, not just within their COCs, but across the state, and needing a place to go to talk to each other, to learn from each other, and to get real guidance and support from their counterparts at the state level. Obviously, homelessness is not the challenge of one agency. There are dozens of agencies represented on this call, and it obviously is also not just a governmental problem. So anything we can do to make that whole of government and whole of community approach come to life goes a long way in making sure that those at the front line of responding to and preventing homelessness get the information they need when they need it, without being, so overwhelmed by all of the updates, all the adversity, and all the information that's there to really be helpful to them. The 3 most common things that we've heard from our research and our focus groups and user interviews, not just in Nevada, but beyond, are first, that documents are easily lost in the hundreds of emails that folks are getting a day. I think, what we hear often is, that piece of guidance might be sitting on a state website or a database, but when you're in the flow of work, you might not know where to find it. The second piece is how tactical questions might be left unanswered, or answered only as a one-off. What the thing we hear most often there is that people don't really know who to go to ask for help, and even when they do, that question might be asked of them dozens and dozens of times, which, from the coordinator perspective, can be hard to swallow when you're, already trying to see across so many different COCs you might work with. And then lastly, it's, the reality that is high turnover among service providers, especially at the front line, wanting to find better ways to capture institutional memory and make sure folks are not necessarily lost when they are trying to get up to speed in a new role or move in a new organization. What that means for us is that we're taking those problem statements in stride and building a system that's meant to be the glue between all the places that people already go. So when we think about, our knowledge management and collaboration platform, we don't think of it as a vacuum. We don't think of it as another place to go. We think of it as the glue that holds all of these things that people are already doing in different places together. And what that means for us is that we're focused on, 4 core functions or priorities that Madeline will walk you through in a bit. The first is really assembling and reaching your entire network. When that comes to the work of homelessness, that means ensuring that different service providers and agencies are connecting with each other, not just within COCs, but across COCs. That also means that we're facilitating real, meaningful, and intentional collaboration, which happens in rooms like these and in conferences that, the Nevada Homelessness Alliance is hosting. But it also means that we're pushing that access down to the front line more consistently and more regularly, so that folks can learn from each other while they're in the flow of work. Over time, what that does is build a strong knowledge base, which again speaks to the power of institutional memory. And as we heard from the Technical Assistance Committee, make sure that people aren't reinventing the wheel in too many different parts of the state or even parts of the COC. And lastly, which might be most relevant to a group like this, the platform can then also provide some meaningful insight and take the pulse of locals and frontline folks to understand what people are really up against or thinking about, what keeps them up at night, and how this group can be more proactive about the support you all are providing to the different COCs and agencies that you're working with. And like I said earlier, this is something that we've been doing with a number of state agencies, ICHs, COCs across the country, both with a focus on homelessness, but also on public health and human services generally. The use cases might range from coordinating working groups and committees like the one that we're talking with today, but it can also do a meaningful job of centralizing resources and facilitating frontline communications. At the end of the day, our work is really designed to save people time, avoid too much wheel reinvention, and make sure that there really is a common place to go when you are working on homelessness and wanting to learn from the broader ecosystem of peers and people and resources around you. I'll pause there. Wanted to see if first folks had any initial questions, reactions, just as we, start firing up the demo. It's helpful to know really what's on your minds, what's on your plates, and where you'd like us to focus the next part of the conversation.
It doesn't seem like we have any questions.
They always come after the fact anyway. So I'll go ahead and just give you a very quick, 5-minute walkthrough of what Austin was talking about and hopefully bring some of that vision to life. And if anyone does have questions, feel free to pop them in the chat, or we can always be reached after this meeting if folks want to see a deeper dive. Essentially at Civic Roundtable, our belief is that folks are wearing so many different hats, are part of so many different working groups, so many different listservs, asked to look at many different tools. And oftentimes what happens as a result of that is that information is lost, silos are dug in, and it's hard to track down that one piece of information that might be relevant to you at a given time. So what we've built at Roundtable is really this landing page and intranet that is secure and built for government use, but easy to use and brings some of the best of what technology has to offer in terms of usability to make it easy to find what you need and who you're looking for. So as you can see here, I'm logged in as someone who's part of many different circles. I'm part of a homelessness services hub. I'm part of different working groups that are relevant to my place and relevant to topics that I work on. And I'm able to kind of flip between these different groups and gain access to them depending on the different hats that I'm wearing. When I pull you into one of the spaces, one of the first things you'll see are that there are a few tabs across the top that really just help me gather all the building blocks that I need to be successful in this space. So first are just discussions that I'm having with peers across the network, whether those are sharing toolkits, asking quick questions, running quick polls. I'm able to pull up resources, actually summarize them automatically, and just get a sense of what's in here and if I should read on, and able to really engage with my peers. So have visibility on conversations. And this is built, these discussions, they can run off interactions you're having in this tool. They can run off listservs and auto-populate the tool. They can also run off Microsoft Teams and other tools you're already using. So ideas just make it easy to have discussions be centralized. You can see people interacting, liking, commenting, tagging by topic, and just again, becoming very easily searchable. All these resources are then pooled into a central library where it's very easy to come here and find anything from video recordings with transcripts attached to them, like the video recording from this meeting, to PDFs, spreadsheets, documents, all kinds of resources get populated into this tool. And you're able to, like I said, come here, figure out why they're in here, the discussions related to them, see what's been featured, and actually also search across the content of the resources. So if I search for veterans, for example, I'm looking across discussions that have been happening on this tool. I'm looking at comments. I'm looking actually at the content of resources, whether those are, minute 4 of the video having answered the question I just searched for, or, paragraph 30 of the 90-page document that was just shared. I'm able to actually get to specifically what I'm looking for really quickly. And I'm also able to see, that Austin has some expertise in this topic and I can connect with him. And I can also even see web pages from tools that we find useful, whether that's the USICH website, whether that's the HUD Exchange, tools from across the web we're able to kind of pull in here as well. So this becomes a one-stop shop, first place to search when you're looking for something. Also able to come in here and just get a sense of who's in here and what they bring to the table. So something we heard from folks all over the country that we're working with is how important it is to showcase not only information about who you are and your title, but also specific expertise that you've picked up across your time in the field. So, here's an example of my profile. It shows you some information about me, but also more specifically skills I'm bringing to the table. Maybe I'm a master at the HMIS system flows and people can reach out to me about that. It shows people projects that I've built and specific resources that I'm attached to. And it also just shows how I've engaged in these community spaces over time. So people can know over time, Madeline's someone to reach out to about X or someone to reach out to about Y. And lastly, just a place to centralize meetings and events and conference agendas and session agendas, a way to keep everybody in this group on the same page about what's where and what's coming up. And again, then go back and attach, meeting recordings, all the attachments, all the richness of the conversations that's been discussed, and just really enable people to stay on the same page. And something that we've seen people really like about this tool is just some of the analytics you can get on the other end about what are people talking about, what are they searching for, what matters to the front lines, what are some of the challenges people are dealing with in real time. And we're always looking to surface those analytics and help people kind of make sense of them. So hopefully this, makes sense at a high level, and really excited to take any questions or dig in and follow on conversations. But I'll just leave you with idea of Civic Roundtable is really to connect practitioners with resources, people, information they need to be successful, and just make it easier to find what you need when you need it, because we know folks are asked to look in so many different directions. So idea of this is really to help consolidate all the places that you're looking and serve as that one-stop shop. And we've seen, a lot of success from some of the places that we're currently working with, and always looking to get feedback and continue building from there. So that was a quick kind of world tour of this platform. Hopefully gives you a flavor of sort of what we do and why we're doing it. And I'll stop my screen share and see if anyone has any quick questions. And if not, Austin and I are always easily reachable. We'll pop our emails in the chat and follow up after this as well. So really appreciate the time.
Do we have any questions from the committee members? We've got a quiet crowd today, you guys. We're gonna let you off easy.
So the technical assistance committee was not as kind.
They were not as kind. I don't think the technical assistance subcommittee is on the call today, so I think you might be you'll probably get some follow-up later from our groups.
Before we let them go, can I ask a question?
Of course.
All right. So it sounds like you guys are a national group. And basically I run the housing finance agency for the state. Just came back from a conference where we talked about homeless funding and so what different states are doing. And so that's my roundtable, if you will. Just kind of wondering how you envision this in Nevada. Because we are a smaller state. We only have 3 COCs, things of that ilk. How do you see kind of your role specifically in the state?
Yeah, I mean, we've been hearing a lot about that from the folks that we're talking to and learning from at the rural COC and elsewhere. The vision is really to start solving a specific coordination challenge for a specific group of people. And as we've learned from our work in other states like Arizona, Oregon, Nebraska, Connecticut, and beyond, by working with COCs first, we're able to really understand how that first line of defense feels in a space like this. We know that every service provider or every region will have different modes of communication. And I know, even though there are 3 COCs, there are some that are encompassing a very large geographic area, and others that are covering very dense but very diverse geographic areas. So I think the number of COCs might actually not tell the whole story of how challenging it can be to get folks in a room like this to talk to each other. And I think the closer you get to the front line of a lot of these COCs, as we've heard loud and clear, not just from our NCOC, but also COCs in other states, is that people might feel disconnected or might feel like they're not getting the information they need or finding the resource they're looking for. So the vision for us is really to start small, solving that specific challenge with potentially the rural COC, and from there bring the state agencies and ICH along for the ride, so that we know that what we're building for them specifically can actually scale to build stronger connections, not just within COCs but across COCs. That is the general trajectory and playbook that's really made our deployments with other states click. And the hope is, in doing so, we can give you all, as Madeline said, some really meaningful insight and information about what different parts of the state need at different times and from different agencies. Of course, we'll always have that broader vision in mind, because as you experienced at that conference last week, there are a whole lot of people in a whole lot of places that can be sharing new ideas or fielding questions that you might not be able to answer within your state. But our theory of the case is that it always starts next door. So if we're able to get the rural Nevada COC house in order and ensure that they've got the infrastructure they need to succeed, we can then scale that to other parts of the state, and even, across the region, given I imagine there might be some similarities in the way homelessness might manifest in a state like Nevada and a state like, Arizona or New Mexico, perhaps.
Thank you.
Okay, thank you. Do we have any further questions or any other comments for the record? Hey, thank you so much for the presentation. And we are going to move on to item agenda 5. We have a presentation by Donica Martinez of Southern Nevada Lived Experience. Donica Martinez will share their lived experience of homelessness with the subcommittee.
Hello, I will also be presenting with my colleagues Amy Jones and Martin Castro. If Amy, we'd like to begin.
Hi everyone, my name is Amy Jones. I'm one of the LiveDex consultants. I want to start by first thanking everybody here for giving us the space so we can highlight some of the amazing work that we've been doing in our community. Next slide. Currently, our team consists of 8 members. In July of 2022, our HUD technical advisors reached out to a number of community partners that were part of the Operation Home push in our community and wanted to do a survey with people with lived experiences and wanted to meet them, meet those individuals and kind of learn from what caused homelessness, what was the start of it, and so forth. So our group met together. Around August of 2022, Clark County Social Services wanted to include people with lived experience in the scoring and ranking process for this consolidated application for the United States Department of Housing and Urban Development, HUD for short. Around late October, early November 2022, these two groups met together and formed LivedX, which today we are called the LivedX Consultants. Next slide. The team began the year with formally being adopted into the Southern Nevada Homelessness Continuum of Care governance document and structure. The changes were approved by the Southern Nevada Homeless Continuum of Care Board at their meeting on February 9th, 2023. Next slide. LivedX consultants have been able to elevate their lived experience on a local, state, and national level. The scope of work ranges from creating surveys, policy review, research pilot projects, program development, and frontline focus groups. Next slide. Martin,
Hello.
our team member, is going to
Hello.
take over the next.
Hi, everyone. So yeah, building on what Amy just said, here are some project highlights. So we can see at the top where we had something that was Southern Nevada based, which would be the scoring and ranking. And then we go to the national level with the National Care Advisors. But I really want to draw your attention or focus to the secret shopper experience. That is really where the LivedX consultants began to get recognition here in Southern Nevada due to their work on that project. That was an initiative that was began as an idea. That wasn't a request. That was an idea by the consultants themselves. And then we will go ahead and give you more details about some of these individual projects that we worked on. Next slide, please. All right. So HUD, the Housing Urban Development, I'm forgetting. So HUD goes ahead and releases a notice of funding opportunity, which is kind of like an award for possible money in the community. And so it just requires that the COC, the Continuum of Care, to go ahead and submit a consolidated application. Now, what that means is that a local competition begins. And so the people that are interested in getting funded go ahead and have to go ahead and not compete, but like compete amongst each other. So the most viable option, the most aligned with the community's goals and are chosen to be included into that package. And so we went ahead and we partnered with the Clark County Social Services Resource and Development Team to go ahead and review and score these applications. We used our lived experience and our frontline also lens to go ahead and see which applications would be the strongest for us to compile together into one single application. And so for the 2023 HUD NOFO, we were Southern Nevada was awarded $21 million. We also participated in the special NOFO, which was exactly like it sounds. It's just a NOFO that was notice of funding that was opportunity that was just that was dropped for whatever. There's some specialized projects that the community wants to go ahead and participate. And for that NOFO, we also were awarded $14 million. So, this is a very competitive and important process that needs to go, that it gets evaluated in the community, but also with that lived experience lens to go ahead and really see which projects could go ahead and have the most viable options in the community. Next slide, please. All right, so here's National Care Advisors. We received a request from the National Care Advisors where it was a licensed registered nurse that wanted to go ahead and get both Southern Nevada and national guidance of how to go ahead and better support the frontline medical staff, so RNs and that type of medical staff in hospital settings to address people experiencing homelessness. And they wanted to identify things like engagement to go identify, discuss burnout and caseload ratios. We went ahead and we elevated personal experiences too, as of what we've seen in the hospital settings, the lack of empathy sometimes, the lack of solutions, the lack of connection to when the person gets discharged from a hospital, because these people are RNs, they're registered nurses, they're trained in medical, they're not trained in the social component of addressing a individual. So we went ahead and we elevated those concerns about like how to go ahead and better engage people in hospitals, especially in emergency rooms. And then we even shared resources so they could go ahead and disperse the information we had, we made them a little kind of like a pamphlet or just resources that were available so they can disperse those locally here in Southern Nevada and go ahead and get those frontline medical staff connected to the appropriate resources that they could pass on to the clients. Next slide, please. One more slide, then we'll come back to this one. Perfect. So here's the secret shopper experience that I discussed earlier. So again, this began as a concept by the LiveDex team. It wasn't a request. We wanted to go ahead and gauge the effectiveness and the experience of what people experiencing homelessness went through when accessing coordinated entry. And so that all begins with an individual going to an access site, which is a place where they can get a housing assessment. And so we wanted to go ahead and see, like, it's exactly like Secret Shopper sounds. We wanted to go ahead and, we use team members and family members to go ahead and build a narrative of an individual, to build a storyline of what anyone outside, anyone that we know, it's just could possibly be going through. And so we went ahead and we went like undercover and we went to these access sites. We walked in through the front doors. We met security. We went ahead and just asking with the one intent to ask for services, to see what the treatment would be like, what outcomes would come out of accessing these access sites, because we wanted to gauge what the individuals were going through. And so we have, due to our findings though, we but let's just say that communities didn't score very high. So due to these findings, we were like basic needs were not met. Like we all know that Southern Nevada is super hot, and like something as simple as offering someone water, was not done. So like something as immediate would be like basic needs, or like even humanizing these individuals, because we have different stories. We have people that would pose as family, as like fathers. We have people that would pose as like teens that were living in their car, and like just the answers we were getting were like, okay, well, you have a car, so try that for a while. Like not even any referrals to immediate resources. And so the secret shopper became I grew into this movement of like, hey, let's address immediate needs, and let's look into the coordinated entry process. Like what is really happening with these access points, with the coordinated entry itself, with a bunch of different points it elevated, and it opened many conversations. And then, so after we had this secret shopper, it even got published to the HUD Exchange. And I don't know if you can click it, but like there's the link so you can find it where the report was published to the Housing and Urban Development website. Can we go back a slide, please? Okay, so here's the coordinated entry flyer. So like I said earlier, that the main mission was to access the access points, and those access points are listed on this flyer through the Help Up Home website. And so this flyer ideally is supposed to be a resource guide that can be given out in the community and be like, hey, like, this is the location that you can go for services for adults, for families, for youth, and for veterans. And so as the initial point of Secret Shopper, we went ahead and we started updating this flyer periodically with the most up-to-date information, because we wanted to check something as simple as, is the phone number still working? Is this the right hours? Is this even the right location? Because people move and don't even update these flyers. So we don't want this flyer to be circulated in the community with incorrect information. And so right now we're in the transitional phase with the access points. So again, whatever that looks like next, we're going to continue to modify, add, or remove agencies, just so we can have the most up-to-date information with our new coordinated entry process that's being rolled out in the community. Next 2 slides, please. That. All right, so building upon the HUD TA, the technical assistance. So in January 2023, the COC board approved some recommendations for the HUD technical assistance to go ahead and review our COC components, which are listed here. And so this was a deep dive into our system. This was like this was a very thorough approach as to what our COC needs help in, how it could be improved, the recommendations that could go ahead and come about, how just a giant undertaking that was done by our HUD TA. And you can see it touches the board, like the board structure itself, the COC board. It touches working groups, data, HMIS governance, and then number 5, coordinated entry, was also in partnership with us, the LiveDex consultants, kind of starting with that initial point of Secret Shopper of like, all the recommendations that came out of Secret Shopper were also baked into these technical assistant recommendations for the whole community to implement. And I would like to say that like, as a board member, we are actually, this is one of those things that we're still slowly implementing, because we got a detailed report. We asked for a report and we got a detailed report about like what changes are needed in the community to go ahead and build a stronger homeless response system. And so while, it can't be done overnight, we are definitely like the work continues to be improved. And one of the things that is constantly being improved on is the coordinated entry. And as a result, we have a new interim coordinated entry assessment process, all due to just elevating this lens of people with lived experience. Next slide, please. All right, so here we have the written standards for engaging people with lived experience. So the county went ahead and wanted to create a policy of what it would be like, or excuse me, a policy of what it is, what they want in kind of like in stone to be written standards for engaging people with lived experience. And so they went ahead and partnered with us to go ahead and review this document to see, is this the right um, approach, to engaging people with lived experience? Are these the right objectives we need to be addressing? Are we elevating everything thoroughly? Are we being mindful of different components that, challenges that people with lived experience may have? So after reviewing this whole document, we felt like written standards was a little too authoritative, like kind of like setting rules, setting like, kind of like set in stone, So instead, we changed it to quality practices, because this document should be the bare minimum of engaging people with lived experiences. Like this should be something that at least people should be doing. So that's why we went ahead and felt like quality practices, along with elevating many things that people with lived experiences go through. Like, for example, even with us with lived experiences, we have a history just as anyone else does, but at the same time, we are not only our history. Like, there's no need to like force anyone to express what they've gone through, to go ahead and like share more than they are willing to offer themselves. And so that's why we felt like quality practices would be the best name for this document. And now this is a policy set out by the Clark County Social Services that can be handed out to agencies that are also hiring or engaging people with lived experience. Next slide, please. Thank you.
Hello, I know we're running out of time, so we'll try to speed this up. In 2023, as a LiveX consultant, I was given the opportunity of attending the National Alliance and Homelessness Conference in Capitol Hill Day with the team representing the state of Nevada. Capitol Hill Day plays an important role in our efforts to end homelessness. Hundreds of people gather every year to meet with their federal lawmakers to advocate for legislation and activities to end homelessness. We were able to go before 5 of our state legislators. These asks are most impactful, especially coming from people with lived experience and frontline employees' perspectives. We are most fortunate that that's what this team consisted of, and we shared our experience, strength, and hope from our personal and professional perspectives. Next slide, please. Some of us LiveX consultants sat on the 2023 statewide conference on ending homelessness planning committee for the Nevada Homeless Alliance statewide conference in Reno. We also presented our findings on the secret shopper exercise that Martin just spoke on, which was completed in Southern Nevada, as well as facilitated a panel with the assistance of the Washoe County Lived Experience Advisory Board. We were met with interest from Northern Nevada COC and from the Carson area community. Next slide, please. Focus groups with Washoe County Lived Experience Advisory Board, LEAD. Martin and I assisted the Washoe County Lived Experience Advisory Board in organizing and facilitating focus groups to gauge the understanding of coordinated entry within the community and its providers, as well as assisting them in analyzing results, data, and preparing recommendations for presentation, in which they are currently presenting their findings on different platforms. Next slide, please. We LiveX consultants created an unsheltered survey that was first implemented in the 2023 Project Homeless Connect, where initially 32 individuals were surveyed. We continue and are currently using this survey at Nevada Homeless Alliance pop-up events and unsheltered encampments, where we go to meet people where they're at and to connect and get real-time honest data, which we'll see on our next slide. Next slide, please. Even though it's kind of small and may be hard to see, I would like to touch on two of our key questions that we asked in our survey, which were, I lost my housing because of, and I feel the number one reason that I'm experiencing homelessness right now is related to. The number one answer for both of those questions were loss of employment, and the second highest answer was eviction. Also, I would like to highlight some answers that were only on the question, I feel the number one reason that I'm experiencing homelessness right now is related to, which was alcohol and substance use and illness or death. which really shows the lack of and the need for access to healthcare and medical services, as well as access to healthcare and medical services connected to housing when it comes to unsheltered homelessness. Next slide, please.
We received a request to participate in the development and study geared to improving our services for youth at risk and youth that are experiencing homelessness with SEI. Our objective is to participate in the development of a study geared to identifying what services we need and how we need to spend funding to show better outcomes for at-risk youth. Next slide. We received a request to assist with identifying youth system barriers and gaps when it comes to our access points for our youth. Due to our community collaboration, our community was awarded this funding, the YESI grant. Next slide. 5 LiveDex consultants attended this year's National Alliance to End Homelessness Conference and participated in Capitol Hill Day. We are able to meet with 6 of our local elected officials and their staff, and we are able to advocate for people experiencing homelessness in the state of Nevada. Next slide. Currently, we have many ongoing projects, as you can see. We are working with the Woodwell Climate Research Center, focusing on how does weather affect our individuals in Las Vegas that are experiencing homelessness, especially our unsheltered population. 3 of our team members are on the Southern Nevada Homeless Continual Care Board. And then we also are part of the planning body and execution team for the Nevada State Conference in Addressing Homelessness, which this year it will be held in Las Vegas on October 7th and 8th, and we hope to see everyone there. Next slide. As we conclude this presentation, we want to take a moment to highlight the unwavering commitment of the LiveDex consultants. We will continue to champion for the voices and the experiences of people with lived experience at local, state, and national levels. Through our platforms, requests, and advocacy, we strive to make a meaningful impact and drive positive change. Thank you for allowing us in this space and for your support of being part of the important journey. Together, we can create a more inclusive and understanding society. If you would like to submit a request to our team, please reach out to the link on this slide. Thank you. And that concludes our presentation. Anybody have any questions?
Do we have any questions, comments, or anything from the committee?
Dr. Katrina, good job, you guys. I think it's just really important that you guys keep elevating the work that you're doing as people with real life experience of homelessness and housing instability, and how important it is that our community knows that people who are closest to the problem are closest to the solution. And I just applaud everyone for inviting you into their space to get the expertise on how to handle these homeless issues, because many of you guys have experienced that. So great job on the presentation.
Thank you. Any other comments or questions from the committee?
This is Administrator Acroft, and this is a little off topic maybe, but first of all, let me say thank you for providing the presentation and sharing your experiences. So while this is not necessarily housing related in the space that I think you're mostly advocating for and whatnot, we've had oppressive heat in both Southern and Northern Nevada for a couple of weeks. As your organization looks at that, is that something that, you know, there's programs or services or something that you know you need just aside from housing so that people can survive in this type of environment?
So I'll just give a brief answer. So the Lived as Consultants are a group of independent contractors that are contracted with Nevada Homeless Alliance to share their expertise to help solve these homeless problems. So of course, when all of us at our prospective agencies or whatever get the list of the cooling stations that are out there, we make sure that they're posted. When we have our events, we're transporting people to shelter. It's kind of like a person's choice to get out of the elements. I think about 20 people died since May, between the end of May and beginning of July in the heat in Southern Nevada. We're also going to be working with the the National Weather Service. We, LiveX consultants, will be working with the National Weather Service to try to figure out how to let people in tunnels know that floods are coming, as well as some other heat initiatives, as well as Woodwell Climate Institute back east, to kind of, gather some information about how the weather affects people experiencing homelessness. Like, all we can do is tell them, hey, there's some cooling stations. Here's the flyer. And do you need transportation at this point, like when it's extremely hot? So I don't know if a LiveX consultant wanted to share, but they all come from different agencies. They're just independent contractors as well.
Thank you.
Shine a light, Danica. What do you guys do? Do you guys do anything for heat, or is it just for flooding?
Yeah, so hello, Danica Martinez. I work for the organization Shine Light Foundation. We do go out, like when we go out and do our outreach every Saturday. We've also been doing it lately, almost every day of the week because of the extreme weather that we're going out there. But what we do is we make sure we reach out, we bring water, we bring anything that can help with anything that will help them cool them down, keep them out of the shade. We try not to make things too comfortable, but something that will help them in that moment or at that time, or at least for a day. And then we offer them help, in which we offer them a way off the streets. If they accept our help, then we go to take them through our process. But yes, we've actually amped up our outreach to almost every day now.
Awesome. Thank you.
Any other questions or comments from the committee? Okay, thank you. We will move on to item 6. We have a presentation from Echo Gill of Washoe County Lived Experience. Echo Gill will share their lived experience of homelessness with the committee. Echo, we are all yours.
Okay, hi everybody. Good afternoon, and thank you for allowing this time and space to share with you our findings of the Coordinated Entry Focus Group project, and to allow us to introduce ourselves to you. Next slide, please. All members of LEAB have lived experience of homelessness within the last 3 years. We have members who are currently navigating the system from various points, and members who have moved on to permanent housing. LEAB was started in 2023 when Washoe County grant to create this board. We currently have 4 LEAB members. Next slide, please. Though we have 4 members, 2 of us will be presenting today. I'm Echo Gill. I have 2 years lived experience of homelessness. One of those years was spent in a shelter here in Washoe County, where my family was not only able to stay together, but we're also able to get the help we needed to eventually move on to permanent housing. Lawrence?
Unmute.
Oh. Hello, I'm Lawrence Dotson. I have almost 10 years of experiencing homelessness. I've stayed at various shelters, and I was able to get help I needed and move into a temporary housing facility. Marshall?
Hi, my name is Marshall. I'm a dedicated individual towards changing how people interact with the homeless. I myself was homeless, which gives me unique perspectives and views that might be helpful. I am currently in a transitional living program, which keeps me moving forward. Next slide, please.
Okay, so far we have participating in rating and ranking. We did a panel where we interviewed agencies that were applying for funding, and we asked them a series of questions and gave them a ranking on that, and the committee was able to use that to help inform their decisions. We participated in the pit count. We participated in all the meetings leading up to it, as well as the count itself. We've done COC policy and procedure reviews. We've reviewed the coordinated entry policies and procedures, where we presented our findings to NNCLC. At least one member has attended every NNCLC meeting and RAW meeting since our creation, and we've worked in conjunction with Two Hearts in an attempt to help get AB 310 passed. We've also did our coordinated entry focus group project where we held focus group, did surveys with unsheltered homeless people, and created comprehensive recommendations to agencies individually and to the county as a whole. Next slide, please. Currently, we are working with the Two Hearts Foundation on a workforce initiative project in conjunction with UNR and TNCC to help get students that are coming into the homeless services workforce kind of cross-trained on everything so that they're coming into things more aware of how the system is currently functioning. We're doing consulting with Winged Wolf Innovations. We are currently waiting to begin work on the rating and ranking committee and to do a panel again this year for that. And we're continuing our work with the Nevada Homeless Alliance, including right now we're currently working on getting together our resource flyer for Washoe County Homeless Services. Next slide, please. Okay. Next, we're going to give you a condensed version of our focus groups, coordinated entry focus groups project presentation, which we've presented at NNCLC, RAW, and still have a few more presentations to go. So we will go through process and methodology, review and results, recommendations, and then at the very end, we'll take all their questions. Next slide, please. So NNCLC approval, we began this process with approval from NNCLC on November 7th, 2023 for a secret shopper experience. However, we learned quickly through our focus groups that a secret shopper experience was unnecessary as we're already receiving the most pertinent information directly from staff and clients. We then termed the project Coordinated Entry Focus Groups. The purpose of this project was to assess the coordinated entry system in Washoe County and the ease of access for both clients and staff. Our goals were to gather input from the community on the coordinated entry system, provide recommendations to improve ease of access, and create a stronger, more functional COC. Next slide, please. Research and training. We reviewed many of the COC policies and procedures with a special focus on the coordinated entry policies, and we were trained on the purpose of the coordinated entry system using guidance directly from HUD. Collaboration. We reached out to agencies that use coordinated entry with special focus on HUD-funded agencies and those that can cater to DV services. Focus groups. We completed focus groups for leadership, frontline staff, and agency clients. We held our focus groups between December 5th, 2023 and April 17th, 2024. Surveys. We conducted 50 surveys with people who are currently experiencing unsheltered homelessness. Surveys were conducted between March 23rd, 2024 and April 8th, 2024. Analyzed data. We compiled all of our data from focus groups and surveys and analyzed it by meeting 2 times weekly, diving deeply into the quantitative and qualitative data to determine trends, strengths, challenges, and any other pertinent points. Agency recommendations and one-on-one meetings. We then contacted each agency to attempt to provide in-person recommendations. For those that could not meet, their individualized recommendations were sent via email. Individual agency recommendations were not shared with other agencies or even Washoe County. We then shared our comprehensive community recommendations with Washoe County and now with you today. Next slide, please. What data was analyzed? We used a series of questions to determine the ease of accesses of coordinated entry, as well as the effectiveness and accessibility of homeless services in Washoe County by gathering data on demographics for both staff and clients, ease of access, the referral process, client knowledge, and also conducting surveys with people experiencing unsheltered homelessness. Next slide, please.
Focus group demographics. In total, 85 individuals participated in the focus groups. 45 were clients and 40 were staff. As you can see here, the race ethnicity of staff is very much similar to the race ethnicity of clients which serve, which is a good thing. The main thing we want to point out here is the next chart, which indicates that 72% of staff members who participated in the focus groups did not have lived experience of homelessness or domestic violence. We will follow up with this on a different slide later in the presentation. Next slide, please.
I think one more slide.
Yeah.
There we go.
Slide number 1, strengths and challenges. First, we will discuss, I think it's one more.
I think you got to go back 2 now. Sorry. Back one more.
One more.
There we go.
Okay. First, we will discuss strengths. All the organizations we spoke to in the focus groups projected a positive outreach and availability when it came to dealing with grievances and complaints. Agencies showed a comprehensive approach to connecting clients with medical services, both the mental and behavioral health aspects. We noticed that all agencies had a desire and a commitment to interagency training. The community as a whole has a raised awareness concerning intimate partner violence and domestic violence. We found strong connections within the various organizations to help individuals struggling with mental health issues. Now let's review the challenges. Please note that recommendations to address these challenges will be addressed later in this presentation. After careful observation, we have determined that there could in fact be an even greater push to effective communication and cooperative collaboration among the many organizations here in Washoe County. We found a common challenge concerning the inclusion of diversity, equity, and inclusion, and an agency-specific coordinated entry policy, as well as a very limited understanding of diversity, equity, and inclusion as it relates to clients. Although all of the organizations have access and at least one individual capable of delivering a chat assessment, we found that this important tool is not being utilized at its full potential. The best way to assess their vulnerability for permanent housing is by the chat assessment. There was a minuscule proportion of people with lived experience employed by the organizations that we interviewed. The need for people with the lived experience is important. Their insight and experience of actual homelessness is invaluable to any organization that deals with homelessness on a regular basis. Next slide, please. Here you can see our data on gender identity, domestic violence, and sexual preference.
Next slide.
Here you can see how long homeless in your lifetime, total length of time homeless, and current length of homelessness at this time. Next slide, please. As you can see here, there was a whooping 82% of individuals surveyed that stated they did not know if they had ever had a chat assessment, and 84% did not know if they were on a housing list at all. Next slide,
We're
please.
one slide behind here.
Are we?
Yeah.
Well,
Can we go one slide forward, please? Okay, there you go, Lawrence. That starts with the 82%.
okay, next slide, please. Thank you. Did you feel safe and heard? We wanted to ask about their engagement, and 44% stated that they didn't feel safe and heard when speaking to a case management outreach. Next slide, please. Alice. Echo.
Okay, it's okay. All right. Recommendations. We advocate for a robust enhancement of DEI policies, making them a primary consideration. We believe this can be accomplished by implementing best practices in the workplace, collaborating with LGBTQ+ agencies to get proper training, ongoing DEI training, not just at higher onboarding and orientation, ensure program policies align with DEI concepts, including coordinated entry policies and survivor of domestic violence policies. Coordinated entry access. We've seen a great many people experiencing homelessness who believe there are no services available to them. We need to make sure that every person experiencing homelessness knows where to go and how to access services. Therefore, we propose creating a coordinated entry flyer. Vulnerability. It is essential that vulnerability is indicated by the chat score, not a personal staff assessment. When assessing a client and placing them in the queue for supportive housing. Information and follow-up. Initiating more coordinated entry at all agencies would be beneficial to everyone involved. Next slide, please. Okay. Trauma-informed care, person-centered. Clients' needs and concerns should be dealt with first without judgment or hoops to jump through. Clients should drive the service relationship. De-escalation training should be provided to all staff. Therefore, staff and any security staff, whether contracted or hired by the agency, should be trained on de-escalation and person-centered engagement. Resources. To effectively address the needs of people experiencing homelessness, enhancing resource sharing among organizations within the continuum of care is crucial. This collaborative approach streamlines the process for service providers and ensures timely assistance for those in need. To further this goal, the community should organize monthly gatherings for organizations. Meetings could identify and share resources for obtaining phones, securing funding for IDs or driver's license, and connecting with temporary labor companies and other employment resources. Additionally, it is essential to make resources widely known and accessible, distribute flyers detailing where individuals can obtain IDs, resume writing assistance, and access to hotlines for those feeling suicidal, create bulletin boards in locations frequented by homeless individuals. Next slide, please. Elevating the voices of the experience is not just beneficial, it's transformative. By implementing these recommendations, we can ensure their valuable perspectives contribute to more effective solutions and stronger community support. Their presence promotes stronger connections as clients can relate better and are more inclined to be open and honest with someone who shares their experiences. We recommend leadership training on hiring and including people with lived experience through resources from HUD, as well as other community and national organizations. Develop flexible policies and practices for people with lived experience staff. Create volunteer opportunities for skill and career development. Intentionally increase agency employment opportunities for people with lived experience, and include statements like people with lived experience of a homelessness are encouraged to apply in job postings. Next slide, please. People experiencing, can we go back one? I'm so sorry. People experiencing unsheltered homelessness, regular engagement. People who are currently experiencing unsheltered homelessness should be engaged by agencies and street outreach teams in order to stay in contact with clients and minimize time spent for individuals. Any contact data should also be used to keep clients up to date on their progress through the system, as well as to provide additional support. Use data to inform. The incorporation of feedback from people experiencing homelessness is essential to making progress towards ending homelessness in Washoe County. This population has unique knowledge of how the system actually works for them, the people attempting to access services. The community of providers should organize monthly meetings with individuals experiencing unsheltered and sheltered homelessness to discuss their needs and challenges. The community of providers should regularly survey and/or hold focus groups with individuals experiencing homelessness to gather detailed feedback on services and policies, ensuring feedback is systematically reviewed and integrated into policy and service improvements. This way, our community can implement data-driven decisions by using the data from engagements and surveys to shape program policy, procedures, and community plans. Next slide, please. Thank you, guys. That's the end of our presentation. Does anybody have any questions they'd like to ask us?
Doesn't sound like they're all, oh, go ahead.
Just a comment. Good job, team.
Thank you.
Washoe County. Right.
Any other questions or comments?
The last comment, this is Dr. Katrina that I wanted to make. We're the agency that a lot of these individuals who are presenting are contracted with. And so we wanted to just let everyone on this call know that it's really important to engage with people with lived experience. And if you have any projects or policies or any things that you're working on, doesn't matter if it's just as involved, if it's related to mental health, substance abuse, homelessness, the individuals in our group have lived experience. And so it's always good to maybe get some feedback or advice from people who've been through that experience as you create new policies, new procedures, new programs. Even something as simple as, is this question person-centered enough if a person has experienced domestic violence or legal engagement? So you can always email me and I can link you with one of the groups if you want to use their expertise in making your programs more person-centered. Thank you, guys.
Thank you so much. Any other questions or comments? Okay, we will move to item number 7, informational only, updated discussion on the progress of AB 310 from Stephen Acroft.
Thank you, Vice Chair. This will be fairly brief with the enactment of AB 310. We've conducted the workshops on both the regulations and program design for the program. We held our adoption meeting for the regulations. Unfortunately, that was the same day that the Legislative Commission met. So we did not get on the last Legislative Commission calendar. For those who don't know, basically once you've designed the regulations, it has to go to the Legislative Commission for approval. And then the regulation becomes, well, a regulation. Before that, it's a proposed regulation. So we have submitted our proposed regulation to that commission. We are waiting for them to schedule the next meeting. Upon the approval of the regulations, which we hope to obtain at the next legislative committee meeting, commission meeting rather, then we will go ahead and open up the applications, provide 30 days for those applications to be filled up. Probably work a workshop in there is my guess, if folks have questions about the application, and then come to this committee with the applications and recommendations. And that's the end of my report.
Well, that was easy. Any questions or comments on item number 7? Okay, moving to item number 8, we were unsure if we were going to have anybody on the line for item number 8. Do we have anybody from the Homelessness Technical Assistance Subcommittee to provide updates? We know that there were some family emergencies, and Shelley, we didn't know if they were coming.
Hi, everyone. This is Brooke Page. I'm the co-chair of the Interagency Council. Thank you for having me, Chair Robert. I just wanted to give a brief update. The Interagency Council TA work group, we've been meeting. We actually didn't have a meeting this week because we have just had an unexpected emergency, but we are working actually on our strategic plan and want to commend the committee. There's been a lot of great work that has gone into the development of the strategic plan. We have, of the 8 strategic issues, there are 6 strategic issues that are complete, with a lot of priorities that have come to the table. And we are working as a committee to identify which of those strategic priorities we want to advance and bring to this committee so you all can kind of see, some of those may be policy ideas that we think would be really important, possibly for the next legislative session. And there's 2 strategic issues: the homelessness prevention and intervention, along with education and workforce development, that we haven't had movement on. And the capacity of those particular work groups are very slim. And so we're meeting actually with the chair of the Interagency Council on July 26th at 9:30, just to have a conversation about the strategic plan, and provide some information about ideas that we have to move this plan along in order to finalize it and provide our recommendations for you all to consider. So we hope to have more information at your next meeting, but just want to give that as an update for today. So thank you so much, and I'll take any questions if anybody has any.
So going once, going twice for questions for the Technical Assistance Subcommittee. Okay, moving to item number 9, informational only, also informational only. Do we have any discussion on the agenda items for the next committee meeting? Shelley, have we done any type of presentation, or could we do any type of presentation from workforce development regarding DWSS and Mike Yoder's team, any targeted workforce development they do for persons that are unhoused? Any outreach presentations that we could give regarding what we do in the corridor?
Not to my knowledge, so we could put that down as a topic for next meeting. That would be a great idea.
I think that would be interesting. I mean, I'm over the agency and I don't even get some deep dives. I don't have we have, for those of you on the line, we have 2,400 employees in the welfare division. So I can't necessarily meet with everybody and know exactly what they're doing. So it's kind of interesting to bring our own staff onto these committee meetings and get deep dives on where we are. I think some of that could be interesting. Does anyone have anything else that they would like to hear about or offer up for a future meeting? Okay, I'm gonna sound, so if anybody thinks of anything, please email Shelley Aguilar and we can have that added. If we have nothing else, I'm gonna move to item number 10 for second call for general public comments. Pausing for anybody that wants to jump in. Okay, item number 10, informational only, general public comments. No action may be taken upon a matter raised until the matter has been specifically added to the agenda. Comments are limited to 3 minutes. If you are making public comment via phone, please call 1-775-321-6111, ID number 459-071-500#. We are now open for public comment. Please unmute yourself and state your name for the record. As I see no public comment, I am going to move to item number 11 and adjourn. It is 2:22 p.m. on July 18th, 2024, and we are adjourning the meeting. Thank you so much for joining.